There's growing awareness of the health problems connected with playing football, especially the cumulative damage from head injuries. But a new study shows the risk is even greater for those who begin playing football before age 12. Researchers at Boston University say players with early football exposure were twice as likely to have problems with behavior and mental functions. To explain is one of the researchers, a professor at BU's School of Public Health, Dr. Yorghos Tripodis. Thank you very much for being with us, Doctor.
Thank you very much.
First of all, talk about more about the kinds of problems that these players would eventually develop.
So what we saw are that those who started before the age of 12 had a threefold increase in executive dysfunction. So these include problems of planning and organizing your thoughts and actions, and also disinhibition and short fusion. And they also had a twofold increase in depression and apathy. So these are mood problems that we see.
And could there be problems going the other way as well, as sort of aggressive behavior, or is this basically people who are...
Yeah, aggressiveness is one of the symptoms that is encompassed by what we call executive dysfunction or dysregulation.
So what's going on with the body at the early age, up to age 12, that's different from later on?
We are not really sure, but what we know is that between the age of 10 and 12, the brain of especially boys goes through this stage of maturation and development that is very critical. So when at that point it gets exposed to repetitive head impacts, that leads to later life difficulties. And that's what we see in this study.
By the way, is this necessarily only about head impacts? Could it be trauma, at least physical trauma, to other parts of the body too?
It could be, but what we look is only brain impacts. So what we look is football players that they only played football as a contact sport, so they didn't have any other exposure to head trauma. We're only interested in head trauma in this study.
Well, talk about the age of the people that you looked at in this study.
So the average age was in their 50s, but the range was 24 to 82. They all have played football, at least one season of organized sport, and they didn't have a concussion in the last year of before they were interviewed. These were the inclusion criteria. So some of them started playing before the age of 12, and some started after. And in some cases, especially for the older people, they grew up in an era where there were not youth programs, so they didn't have the chance to play football at an earlier stage.
How long did it take for some of these problems to emerge?
Again, we see a huge variability. For some people, we see as early as a few years after they stop playing football. By few, I mean 5 to 10 years. And for some others, it takes decades. We're not really sure why it takes so long for some people and so short for some others. There could be some other environmental or genetic reasons that we don't know about.
I think, I remember a time when even concussions were not taken that seriously. I mean, sometimes there are obviously ones that are worse than others, but they seem almost routine. I guess, but now people cannot do that anymore.
No, in most youth teams, even in the professional league in NFL, there is a concussion protocol. So if there are symptoms after head impact, there is a protocol that the players and the coaches should follow. But the most important part is not actually the concussion, so the brain hit that results to a symptom such as loss of consciousness or ringing in your ears. The most important part is the subconcussive blows, so hits to the head that result to no symptoms, but on the other hand, they may have they may result in a problem with the brain.
And of course, this isn't just about the smaller ones also being a problem, but you've got this cumulative effect maybe? You get one after another and another?
Exactly. So what we see is that the average football player at high school receives 600 hits per season that exceed 15 Gs. That's the equivalent of a 25-mile car crash. And they receive it season after season. So if you play for 10 years, you would receive 6,000 hits. That would be the equivalent of being in 6,000 car crashes over your lifetime.
This has been News, and we're talking with Dr. Yorghos Tripodis from Boston University School of Public Health. Now that this study has come out, I mean, are people calling the researchers and saying, give us some advice here, what should we do? I mean, do you have any initial advice at least about what should be done?
It's very difficult to do policy based on a single study, although the evidence is slowly accumulating that the earlier you start, the worse the difficulties later in life, and the more blows to the head, the bigger the problems. But what we need to do as parents is to think whether it makes sense to leave our children off a field, especially at an early stage, put them on a plastic helmet and a face mask and let them hit their head hundreds of times per season.
Of course, another thing that I'm trying to theorize my way through here is that, is there a way that younger players can somehow develop football skills in a way that's less exposing them to the physical harm?
So what we see is that they could play flag football. So this study is about tackle football, but they can play flag football and learn the tactics and still be successful players. I mean, we see that Tom Brady didn't play football till he got to high school. So you can be a successful football player without being exposed to hits earlier in your life.
Thank you very much for being with us.
Thank you.
Dr. Yorghos Tripodis from Boston University School of Public Health. Still to come, a new history on the fall and rise of Boston.